friends. I am Dr. Harvinder Singh. Welcome to our next discussion video. So, topic for today is answering this question: is olanzapine efficacious for bipolar disorder mixed specifier? You're right. We already know the efficacy of olanzapine for the bipolar mania and depression. This topic is only specific to the mixed specifier. And the next few minutes of video that you will watch is from our Bipolar Disorder Update 2020 conference where I presented on this topic. Actually, my presentation is 1 hour 20 minutes long. I have only chosen a very small section on olanzapine. So I will request that you watch this video completely because in the end, I have also discussed the topics that I have included in this complete presentation and a little bit more about our conference. So I will see you again at the end of this presentation. So now after knowing the diagnosis, doing the assessment scale, comes the important topic of how to manage this. Now, this is very, very clinically relevant topic because this is a very new addition in DSM-5, and most of the studies that were done on DSM-4 mixed state criteria. So, to make it more meaningful, clinically relevant, and easy to understand for everyone, what I have done is, this is what is of relevance to everyone here. You will be able to download this in the PDF form, but in the end, all the medication that I will talk about will be included here. As you can see, these are mainly from the WFSBP guidelines, but I will put some more inputs from other guidelines also based on how we proceed. Now, you see there is this blue on top, which is acute treatment. Green is the maintenance treatment recommendations. And in acute treatment, we have manic mixed and depression mixed. For maintenance treatment, the list was very long, but I have made it only in 3 columns right now, which is preventing depression episode after mixed, preventing mania episode after mixed, or preventing new episode after mixed index episodes. Now, we will come back to this again. Let's start with our medication number 1, which is olanzapine here. And what I will do with each medication is I will very briefly talk about the study and then the recommendation grade, and then we will go to that table that we just talked about. Now, let's start with efficacy of olanzapine in bipolar mania with mixed features. And to answer this, there was this study published in American Journal of Psychiatry, published by Tohen et al. In 1999. And this study compared the efficacy of olanzapine versus placebo in patients with the DSM-4 criteria for manic and mixed episodes. And this was also called Olanzapine HGEH study group. And this have total of 139 patients, 17% were mixed episodes. And the study showed that olanzapine was significantly superior in improvement in manic symptoms in both patients with manic and mixed manic features. Episode I should call, because at that point this was all DSM-4 in 1999. And another study did the same thing, published in 2000. Efficacy of olanzapine in acute bipolar mania. So there were 115 patients and they found 42% had mixed episode, and olanzapine showed a very significant response rate in both manic and mixed episode. And there was one more interesting point about the second study that we are talking right now. They found that patients who had a HAM-D score of more than 20, which is severe depressive symptom, they had a greater improvement with the olanzapine in reducing depressive symptoms. I know we are talking about mania with mixed feature, but I just thought we should know this because olanzapine also had a good efficacy for the depressive symptoms also. But for mixed right now, very good response in the study. And then we have this post hoc analysis published in 2014, again by Tohen et al. In Journal of Affective Disorder. So you will see that most of the data is from post hoc analysis moving forward. So what they do is they pool data from prior placebo-controlled studies, and then they look at the mixed feature specifier on those patients, and then they make results out of that. So this study actually had a pooled data from 3 placebo-controlled olanzapine studies in patients with bipolar 1 disorder with manic or mixed episode. And the results were very positive for olanzapine group. Olanzapine was efficacious for mania with or without mixed feature. And as I mentioned in the last study, the greater efficacy was observed for someone with more severe depressive symptoms, which is, HAM-D score of 20 or more. I'm not going to bore you all with details of the study. You can go in the reference section of the PDF of this presentation. And if you're interested in learning more, you can go there. I will put the link of each article. But to summarize this in a table again, for acute manic mixed features now, for monotherapy, the WFSBP guidelines say category of evidence A for manic and C for depressive symptoms, but we'll focus on manic right now. And you know that A category of evidence is equal to either 1 or 2. But you will see that none of the medication received recommendation grade 1 because none of them was meeting good risk to benefit ratio. So the score recommendation grade for olanzapine for mixed manic episode was 2 here. So as a monotherapy, be mindful, we are still in monotherapy. We'll talk about augmentation in a few minutes. So let's go to the table. Where does this 2 score shows up on table? So we have this table here, and olanzapine had the highest one, recommendation grade RG of 2 for manic mixed acute treatment. Now, how about augmentation of olanzapine for same diagnosis, manic mixed? So for augmentation, there was this study published in 2004 where olanzapine was combined with valproate or lithium in dysphoric mania. And this was actually a secondary analysis of a 6-week double-blind randomized study. Olanzapine was used between 5 to 20 milligram per day versus placebo, and they were combined with ongoing treatment with lithium or valproate. And the study was very positive. Significant improvement noticed in the olanzapine group. And they found not only that, but this group also had improvement in the depressive symptom and suicidality rating. So you must have noticed by now that very good equal efficacy for the depressive symptoms also with olanzapine right now. Going back to our table, we talked about monotherapy for acute manic mixed. As an augmentation agent, the score, the category of evidence was A. And we know where A goes to recommendation grade of 2. So this was monotherapy grade of 2. For combination, the grade is again 2. So here is our table updated to augmentation. Although I mentioned valproate there, I should write mood stabilizers. But olanzapine alone and as an augmentation agent have very good efficacy for manic mixed episode. And one thing you will notice moving forward with valproate or lithium, most studies were, these atypical or typical antipsychotics combined with these medication. And we'll see how that made us difficult to compare lithium or valproate efficacy. But Moving on. This was Manic Mixed. Now, let's move to the second one, which is Depression Mixed acute treatment with Olanzapine. So for this, there was this meta-analysis, more of a post-hoc analysis of the efficacy of Olanzapine monotherapy in bipolar depression with mixed features, published in 2014. So this was a post-hoc analysis where they pulled data from two placebo-controlled Olanzapine study, and the results were that Olanzapine monotherapy was efficacious in bipolar depression irrespective of the presence of concurrent manic symptom. Now, here's an important thing. When you look at the grades, the grade for monotherapy is C here. The reason it's not A or B is because this was a post-hoc analysis. If you look at the details of what A, B, and C means, C is more on a post-hoc analysis range. A and B are more, those randomized placebo-controlled studies with good evidence. That's why the grade dropped for acute depressive mixed features with Olanzapine. And for augmentation, there was no study found, so they marked it F with lack of evidence. But looking at C now for monotherapy, C will go to recommendation grade of 4. So for depressive mixed state, as a monotherapy, Olanzapine comes here. Now, this was the acute treatment. As you have seen so far, good efficacy with Manic Mixed, equally good efficacy, but the grade is low because of the post-hoc analysis data available. But moving on to maintenance treatment, do you think Olanzapine will have efficacy in the maintenance treatment? So for maintenance treatment after mixed episode, how efficacious Olanzapine is in preventing future episodes or recurrence of mixed episodes. So for this, we have a randomized control trial. Now this is very important. Look at the randomized control trial written on top. That increases the grade for these guidelines for Olanzapine. So this study actually looked at 121 patients. They were randomized to Olanzapine and placebo. And the result was that compared to placebo, Olanzapine had longer maintenance of response, 46-day versus 15-day. And this was statistically significant. So when you look at the table, preventing new episode after mixed index episode as a monotherapy, grade is B. You see the grade went up because this is a randomized controlled trial. And the studies were not available for augmentation, so they marked it F as lack of evidence. But going at the monotherapy grade of B, so B means the recommendation grade goes to 3. So let's see if we can put this on our table there. So Olanzapine had a good efficacy in preventing or recurrence as a maintenance treatment after mixed episode. Also, they looked at other studies. I'm not going to go into details of that, but I will just summarize them here. So they also looked at preventing mixed episode after a patient have manic or depressed index episode. The category of evidence was little low, D, and D goes to the recommendation grade of 5. So it comes down here after manic episode preventing mixed. So you can actually read this in the PDF summary that you must have downloaded already. This is what we just talked about. So this was a very brief overview of what WFS-BP guideline tells us with Olanzapine. Let me actually go back. Yeah, this one. So we saw that Olanzapine is very, very good efficacy in acute treatment, very good efficacy in maintenance treatment also. But let's actually go to the second study that I was telling you, this systematic review, which was published almost, I think, close to 1 year after this guideline publication. And this systematic review included other published studies also. So what this systematic review tells us is that olanzapine had the best evidence for acute mixed hypo, mixed manic, or mixed depressive state. We saw that already with the guidelines, and also for the maintenance treatment. Well, this systematic review kept olanzapine on top compared to any other medication. So that's why I included this here, to see if these two things match or not, and they do match. So that's why I started with olanzapine, because this medication had the highest evidence of all other medication. But again, we all know that olanzapine also carries the highest risk of metabolic side effect. If you look at the other guidelines, I think the most recent guidelines published for bipolar depression in the psychopharmacology algorithm project by Harvard South Shore, they have recommended to taper someone off of olanzapine, not to continue it for a long time, because the side effect does not outweigh benefit. But these guidelines were published in 2018. I will still recommend olanzapine to be used with caution. That olanzapine have good efficacy, but you should definitely try other options if available before jumping onto olanzapine.
So friends, thanks for watching this video on the role of olanzapine. I hope it was helpful and clinically relevant for everyone. So in this talk that I gave to our Psychiatry Education Forum's Bipolar Disorder Update 2020 conference, this whole lecture was 1 hour, 20 minutes long. And in this lecture, I talked about what is the diagnostic criteria for mixed specifier, how is the mixed specifier of DSM-5 different from DSM-4's mixed state, and why is diagnosing mixed specifier that clinically important. And then I have also talked about 3 scales that you can use in your daily practice. Actually, 2 of them you can use in your daily clinical practice to diagnose mixed specifier in addition to your interviewing skills. And in the end, I have compared 20 treatment recommendations for bipolar mixed specifier, and I have ranked them in this table that we just talked about a few minutes ago. And this is just one presentation in this conference. We have total 10 presentations. If you're interested in learning more, please click on the link below to go to the conference main page. And this is an online conference. You can join anytime, finish anytime, and get CME credits for that. And again, if you have any questions about this conference or anything else for me, don't hesitate. Send me an email on hsingh@psychiatryeducationforum.com. So you all have a good day, friends. Thanks for listening to me again. Take care and bye for now.